Welcome to the Black Gems Dive In Podcast, the podcast where we dive deep into conversations about inclusive cultures and everything DEI. Your co-hosts are Kua and Kendra, and we're thrilled to be your hosts as we explore the crucial topics shaping our workplaces and communities today. In each episode, we'll unpack insights, share stories, and engage with experts to foster a deeper understanding of how we can create more inclusive environments where everyone feels valued and empowered.
Hey, Kua.
Hey, Kendra.
We're back. I can always say we're back for another episode, but we are back.
We're back for another episode.
I don't know why I'm shocked every single time.
Episode 55.
Is it 55?
It's episode 55.
Okay.
So Jamil told us over the weekend that we hit a milestone, y'all. We hit 50 podcasts.
Yes.
Recorded podcasts.
Yes, recorded podcasts. Yes. And I think about even like when we started, we were just like, I have no idea where this is going to end up, but we know that our voices are needed. Yep. And a lot of people look to us for just some insight and just to think about new things. So yeah, it's exciting.
Yeah, it is exciting. And I think, we always have a lot to say, a lot to dive into. And I especially like how we've started to kind of segment this in a way where we're like, all right, y'all, this is all the stuff you need to know about right now with our diversity dispatch. Then we go into some hot topics and, just the general conversation of what we want to discuss.
Absolutely. So are we going to,
I was going to say, like, how are you? How was your weekend?
We were just talking about it. We were outside, y'all. We were outside.
Sunday Fun Day was in full effect.
We did. And it's nice, though, because you do need that balance, right?
Oh, for sure.
You definitely need that balance. And it was great just to support friends and just local things that's going on. I know Jamil's behind the screen here and behind the camera, but Jamil had Peace and Afrobeats.
Peace, Love, and Afrobeats.
Yes.
Yep.
So that was a vibe.
Yeah, it was a vibe. A live band playing on top of Afrobeats, like really popular songs.
Yes.
And then there was somebody that was singing too. So that was really cool.
Yeah.
And then we also supported Lindsay with Buffalo, their event, the Mix It Up Challenge. So it was a good time. It was a good weekend.
Yeah.
We
love summertime in Buffalo.
Right? Because, everything just livens up in Buffalo because this summer season is usually very short.
Absolutely.
Although it did get hot really quick.
It did. It got into the 90s, and then now it's cooler today. But it feels good just to, be outside. My birthday's in a few weeks. I'm just going to put that out there.
She keeps saying, all right, y'all. She keeps saying this. It's cancer season.
It's cancer season. Because when is Leo season? I'll give you your season.
Y'all know how us Leos do, so fair enough.
Yeah, so cancer season. So, just got to put that out there.
So let's dive into our discussion today. And so we're actually going to do a diversity dispatch, right? And so we've been watching a lot of what's been happening behind the scenes as it relates to DEI and anti-DEI measures. And unfortunately, this is another one of those, right? And so we're reading, this is actually coming out of HR Policy Association. And the news is around this anti-DEI Republicans introduce a sweeping bill to shut down federal programs. And so it says, despite a new poll showing strong public approval of DEI programs, Senator J.D. Vance, he's a Republican in Ohio, and Representative Mike Cloud, who is a Republican in Texas, have introduced the Dismantle DEI Act. And so this act is to eliminate all federal DEI programs and funding for federal agencies. The bill, co-sponsored by 26 other Republicans in Congress, would also establish a broad prohibition against federal contractor DEI programs, such as anti-bias training, which the public supports. And so it goes on to talk about public support for DEI, and it said that a new Washington Post ISPOS poll says that 2,200 Americans indicate that they have a 61% view of corporate DEI efforts as a good thing, right? And this percentage increases to 69% when those efforts are described, which is very important to kind of highlight, because we've talked about kind of coming down in language to make sure people understand what this actually is.
And it's a commonality.
And once you understand it, the support increases even more.
Exactly.
Which, just shows we got some work to do, right? But it also talks about both anti-bias training and mentorship opportunities for underrepresented groups are supported by 75%. Similar majorities support internship for underrepresented groups, that's 70%. Recruiting underrepresented groups, 67%. And employee resource or affinity groups for underrepresented groups, 64%. So that's the public approval of all these programs when they're described and people understand them. It says, however, companies have scaled back certain programs following the Harvard decision and pressure by anti-DEI advocates. So the reality is, in general, the public is in support of these initiatives, especially when they understand them. And yet we still have this large push, and we've talked about the relation to it being politicized and what that looks like, but
And we know there's a lot of states, right? There are states, particularly in the South, who have already established these type of bans and introduced these bills, right, at a state level. Because when you're reading this, you're like, well, hasn't this stuff already been happening, right? But at the state level, but this is a federal level bill that is being issued. And so, because even when this started happening a few months ago, we were talking about, well, what does that mean for us as practitioners in this space? But this is like you said, a federal bill. And it goes on to also talk about the bill broadly defines DEI as discriminating for or against any person, of course, of basis of race, color, ethnicity, religion, biological sex. So already in violation of the Civil Rights Act of 1964. And it also says requiring as a condition of employment, a condition for promotion or advancement, or as a condition for speaking, making presentation, or submitting written materials. And it goes on to say that an employee undergoing training, education, or coursework, or other pedagogy that asserts that a particular race, color, any protected classes is inherently or systemically superior or inferior. So everything that, when we're talking about DEI, and we're talking about in this space where people may say, what about me, right? This excludes me. This is anti-DEI. We know that, to your point, this is not being explained.
It's not.
It's not being broken down. So this is a very high level, right? This goes according to years ago when we were hearing about critical race theory, all these different things. A lot of this sits in the hypothetical, right? This is not rooted in theory. This is just based off of feelings, in my opinion.
I think it's feelings, and it's also pushing, different pressure points that the public is really open to right now because of some of the swinging, the pendulum swinging back. And so it talked about, the harsh rhetoric that came from that press release from those Republicans. It says that Senator Vance asserts that the DEI agenda is a destructive ideology that breeds hatred and racial division. Americans' tax dollars should not be co-opted to spread this radical and divisive ideology. And then Rep. Cloud states that these initiatives presented as promoting fairness have instead fostered division and racial bias within our institutions and culture. This bill is a necessary step to restore merit. We keep talking about that. Merit and equality, not equity, in America's government institutions, and eliminate the DEI bureaucracy that sows division and wastes taxpayer money. And so I think that it just kind of reiterates our point, right? In describing these efforts and bringing it down in layman's terms. And saying, hey, this is what DEI means, right? We're talking about pay equity. Don't you want to be paid fairly?
Right.
That's something that we all want, right? Like being able to break it down and say, don't you want to be treated fairly in the workplace? You don't want to be discriminated against because X. And I think that's the other piece that's so interesting to me, is that they're trying to paint this narrative that that's what DEI is doing, when the reality is that's what DEI was actually fixing.
Exactly.
Right? Like DEI was coming in saying, let us all teach everyone how to properly, interact with one another, making sure we take bias out of decision making, making sure that we increase your voice as a person as within this institution or organization. And yet what we find is that they're flipping the narrative and saying that this is now saying, oh, we're only going to promote this certain person who is not qualified over this person. And that's not the case at all.
I mean, it goes back to everything we've been talking about of dismantling systems, right? The system is set up and it's working and designed the way that it was supposed to from day one, right? And so now when you're dismantling those systems and what that looks like, there's a lot of people who, again, going back to those pressure points, are like, I feel uncomfortable and I have the power, right, to change it, and I'm going to change it back.
And that's exactly what they're doing. That's exactly what's happening. So, you know, we find ourselves in this position yet again, and we liken it to civil rights. People argued against civil rights. And they still do in a lot of different ways. And so we just know that this is not new. It's been something that's been attacked before, and now we just have to find ways to really, center this as a part of an organizational culture and how people are operating on a regular basis.
And it's going back to dismantling Civil Rights Act, like we talked about 1964, right? It's going back, repealing those things that were put into place, and we just have to keep fighting the good fight.
That's it.
Right? We keep saying it's an election year. We're going to go into what that looks like now.
Right.
But we just have to keep, dismantling the systems, and it takes a concerted effort to do so.
It does.
Yeah.
It does.
Yeah. So that was our diversity dispatch.
Yeah.
And so now we're going to move into our hot topics. So as we continue to talk about just some of the systems that were dismantled, we talk about Roe v. Wade and abortion and what that looks like. But we know now in New York State, there's an article that came out actually by, it was in the Pink Elephant newsletter, which is which is in LinkedIn. And I know Kua and I both follow the author, Janice Gessom Asari. So the article says New York Medicaid recipients now have access to doulas in effort to improve maternal health. So on June 10th, 2024, New York Governor Kathy Hochul announced an $8 million investment to improve infant and maternal health across the state of New York. In addition to ensuring that prenatal care is more accessible to New Yorkers, a standing order was issued to provide access to doula services for birthing parents. The announcement comes at a time when the maternal mortality crisis in the United States outpaces every other high-income country.
Yeah.
For Black women in particular, the maternal mortality crisis is even more dire when the Centers for Disease Control and Prevention, the CDC, reporting that Black women are at least 3 times more likely to die from pregnancy-related causes compared to their white counterparts.
Which is insane.
It is.
For so many reasons.
It is.
And it's a conversation that as Black women we
always have, yes.
Right? To the point where, and just to call it what it is, like a lot of my friends, a lot of our friends, we talk about dating, we talk about marriage, we talk about having children, but making sure that you're having children with someone who could potentially be a single father.
Exactly.
If you don't survive,
real conversations,
right? And so
have.
making sure that you have a partner that you're having children with that can handle that, right? And it's a scary reality to say that out loud, but at the same time, it's the reality.
Yes.
If Black women are dying at 3 times, more than any other race,
right,
we have a crazy problem on our hands.
Yes.
And so we do need people like doulas who can advocate for us when we do decide that we do want to be, mothers and give birth.
And I know here in Buffalo, there's a lot of conversations surrounding doulas and the support and advocacy groups surrounding them as well. I know personally, people in my family have had doulas just because they feel obviously just more comfortable when it comes to childbirth. But we also hear too personal stories of our friends who've had, unfortunately, their daughter or son literally on a gurney in the ambulance because they were told like, hey, don't come to the hospital. Those contractions aren't real, right? Or it's all up in you're making it up in your head or whatever the case may be. And so a lot of times when it comes to Black women, we're not even believed when it comes to the pain that we may be in or whatever the case may be. And I know personally that was a story for even my mother, right? Where initially they were like, oh, she's fine. But on top of fibroids and everything else, there's just so much that goes on.
Which I think from a fibroid standpoint too, we have to do some more research there, but I think Black women get that at higher rates as well, right? And so the complications that can happen in pregnancy only increase. And so, while we talk about this as, an issue that's related to women's productive rights and, folks who identify as women and their productive rights, at the end of the day, this impacts everyone. Whether you have a brother, like a sister or a mother or someone who might consider giving birth again, this is something that you have to be aware of.
Right. And we go back to some dismantling these systems and rights, equal rights for all.
Exactly.
This is a part of it, right? This is a part of the conversation. And the article also goes on to talk about how data from the CDC from 2018 to 2021 indicates that states with the worst maternal mortality rates include Arkansas, Mississippi, Tennessee, Alabama, respectively. And so although in New York State, we have better than mortality rates than other states, Governor Hochul emphasizes that areas like the Bronx have some of the highest maternal mortality rates in New York, and the Bronx having the highest poverty rate out of the 5 boroughs in New York City.
Yeah, and so it says that Black women in New York City are 9 times more likely to die from pregnancy or childbirth than white women. And this is in New York City, right? We're talking about one state. And so the states that we mentioned before all being in the South, I think that aligns with a lot of the things that we're seeing from a healthcare perspective in terms of healthcare outcomes and what that looks like in some of those states, which, you know, when you think about DEI representation and the importance of this, it connects into healthcare, right? And as someone who used to be in healthcare, we used to talk to our providers around what bias looks like. And so if someone's presenting and they look a certain way, you might consider them, you know, oh, they're outcast because look at them, they come in like this. And then, oh, someone's coming and they look, you know, well-dressed or whatever, then we're going to perceive them a certain way. And so even when we think about bias in the relation of the types of care that you can get, you know, from doctors, that also impacts that. So when you talk about anti-DEI measures, this is also what it impacts, right? And I think people don't recognize how this is connected in all these different places and spaces, but the reality is you get rid of DEI at that level, these outcomes are only gonna get worse. You know, the awareness decreases, and I think there's been a lot. You remember the 1619 project that came out, and one of the stories that they did was specifically on healthcare. And it talked about this lung spirometer as a measure of seeing someone's full lung capacity. And it talked about how back in slavery times, they used that as a mechanism to say, oh, this is why you have to work the people who were slaves, black people, even harder than anybody else. And yet they accounted for a difference in that because of slavery. And now that's something that they only dismantled how many years ago? Maybe 10 years ago. Right? And so now when you went to use that lung spirometer, they actually adjusted it saying, oh, you're black, you have a lower capacity. But the reality is that was only used to work slaves harder. And so there's things like this that are intertwined in terms of our healthcare that we're not even aware of because, you know, it's not being taught. The reality around the pain and what pain black people or people of color feel and how that's lessened compared to our white counterparts, that's something that was in textbooks for med students. These are all things that still exist, but without these DEI notions and actually having conversations around them, you're just not aware of the disparity. You know?
And last week I attended a conversation about social determinants of health, and it was sponsored by the Buffalo Urban League Young Professionals. And a couple of things they were talking about, someone said, you know, if you can envision any type of program to put into place that kind of would address some of these issues, what would it be? And one of the panelists talked about, you know, when you become a doctor and having your clinicals to do a rotation, right? Different places around the cities that you're going to be in. And someone said, actually, they were like, listen, if you're going to treat the hood, you need to be in the hood. That's what someone said, which is facts, right? But you also, too, need to understand not necessarily things that can't be found in a textbook, right? You need to have that quantity and qualitative data in order to really address someone's issues. Right? You need to be able to just hop in and be like, this is what I need to do and assess that, right?
And then also from a cultural awareness standpoint, be able to connect with the folks who are coming in. What are the cultural practices? I think I mentioned how my dad, he did not want to get that vaccine, but he had a Ghanaian doctor in Atlanta who talked to him and was able to connect to him in a way that he said, okay, I'm going to do this. And it was literally because he had that cultural connection with the doctor. Those things are really important, right? But we don't think how important they are until we don't have them and it's not a resource and we're being told to do something that's not even in alignment with our own culture and practices.
It goes back to that medical apartheid that we talked about and, you know, all the things with Henrietta Lacks and Tuskegee and all those things. So, but, you know, to round this up, one of the things that they talked about in the article is that in order for us to increase some of these outcomes is really to make sure that we have access to information. And so increasing access to information can play a vital role in addressing the abysmal maternity mortality rates. Conversations, education around it is really critical and it's a must. They also says in 2023, Baby Dove and Sister Midwife Productions partnered to develop a much needed list of Black doulas across the country. Recently, the Birth Fund was created to expand nationwide access to midwifery birth support services and is filling the gap by providing those most in need with the necessary care. And then lastly, it says the Black Birth Equity Fund is another resource created to provide Black birthing people with grants to cover doula services. Offering doula services through Medicaid is just one of the many efforts that must be taken to improve maternal health outcomes in the U.S. Providing access to doulas and midwives is paramount to addressing the maternal mortality crisis.
So lots to, you know, keep in tune with. I think the beauty in this is that New York State is recognizing this disparity and putting some type of, you know, action in place that will then allow folks with Medicaid to be able to, you know, access doulas. And so the reality in this is there's a positive. There's, you know, New York State is doing something.
Yeah.
We also know that this needs to be done in other states. And so maybe people will follow the lead if we start to see better health outcomes.
Yeah, it'll be interesting to measure that as well.
Yeah.
Yeah.
All right. So we're going to go into our main topic, which relates back to what Kendra talked about earlier, right? And that this is an election year. There's a lot of stuff that's on the line. I think, you know, we talked about women's health care. We talked about abortion being a topic of discussion, especially being that it was struck down at the federal level. So a lot of this is going back to states, but, you know, there's measures and people are proposing things that would even restrict what is in line now, right?
Yes.
So what are the things that we need to be concerned about? And then, you know, the black vote being a major topic.
Yes. And so just to kick off this conversation is another article. So we want to make sure, first of all, that we're rooted in facts with this conversation. We know that when you're talking about the presidential election or any election, it can be contentious. We're not here to tell you who to vote for. But we also want to present the facts based off of what we're seeing in the research. So it says at the Pew Research Center, so it talks about key facts about black eligible voters for 2024. The number of black eligible voters in the United States is projected to reach 34.4 million in November 2024 after several years of modest growth. And black eligible voters stand out for turnout rates higher than among Latino and Asian eligible voters. Black voters could play an important role in determining the outcome of key 2024 elections, including the U.S. president. And in Georgia, a closely watched swing state, black Americans account for a third of eligible voters. In 2022, 92% of single-race black non-Hispanic voters cast a vote for Democratic Joe Biden, while only 8% backed Republican Donald Trump, according to a Pew Research Center analysis of validated voters. So ahead of the 2024 presidential election, it goes in to talk about different facts about black eligible voters for the U.S. And then different projections for 2024 based off of census data. One thing that is key to talk about here as well is obviously we're back in the same predicament in 2024 than we were in 2022 or 2020. Sorry, there's so many things that play, but also too you're starting to see where some of the specifically when it comes to the presidential election, Biden and Trump are starting to kind of infiltrate in other spaces that they didn't before.
Yeah, and you know, this is something that folks call out all the time as it relates to authenticity versus, you know, this just being performance.
Yes.
And so one of the things that black folks will tell you is, you know, come election time, that's when you'll start to see a bunch of different politicians coming to church. They're coming to talk about their message and what they want to, you know, leave potential voters with. You'll see different events that happen, you know, Juneteenth being one of them. That's when a lot of politicians will come out. And the reality is a lot of organizations do too, right? Like they go out to talk about their message because this is a key segment of the population that they're trying to reach. And so one of the things that I think the article, the Pew Research article talks about is that black Americans are projected to account for 14% of eligible voters in the U.S. in November. The percentage of eligible voters who are black has risen slowly in the past 2 decades. In 2012, for example, black voters represented 13.2% of all eligible voters. In the last U.S. presidential election in 2020, they represented 13.5%. It says as of 2022, about half of black eligible voters live in one of 8 states, which is also really interesting too, because I think that's also why you're starting to see more of this performance stuff happening in some of these states. And so it says that Texas had the most black eligible voters in 2022, but DC had the highest share. And so it said that Texas, Georgia, Florida, New York, California, DC, Mississippi, Georgia, Maryland, and Louisiana is where those larger numbers, you know, are in terms of states. And so although black voters make up nearly half, 45% of all eligible voters in the District of Columbia in 2022, it was a higher share than any other state, which I don't know if that's as surprising, right? Like DC is a place where all the politics
black Mecca
happen, right? And so the biggest share being there, I think it'd be interesting to overlay levels of education with where voter registration and also voters voting happens as well.
Yeah, absolutely. And so if we, the statistics are there, we see where the increases are happening in particular states and specifically also too in the District of Columbia. But they also talk about, and I had an opportunity back in March, I believe, to go to the National Urban League Legislative Policy Conference, and that's something where the National Urban League convenes every year in D.C. with the Washington Bureau, and just talking about what things are coming into play for each year. And there was a presentation that I was able to participate in, and it was by Hit Strategies, which is, if you have an opportunity to look up Hit Strategies, they're really good at just diving right into the data and just giving you like straight facts. One of the things that they talked about was the Black voter power shift in different clusters over time. And so we, based off of the data that we just saw and that we just read to you all, we see that there are, several different things. This is what they talked about as well. We have to continue to activate what they call the legacy civil rights, right, when it comes to Black voters, which is really important. It's about 30%. And what they said was that typically this group, one thing they will talk about is my ancestors sacrificed too much for me not to vote. So I'll wait in line as long as it takes.
And so they talk about generations though, right? Like in terms of that sentiment?
Yes. So that generation, those legacy civil rights, is ages 50 and older, right? That's that cohort. It's also really important, and we'll talk about this too in the conversation about where you're seeing some of these politicians like Trump and Biden who are really leaning on the pop culture, right? And we'll talk about, where they kind of fall in. But this group is 30%. They say we have to activate them, but we don't necessarily have to organize them, right? So when it comes to that group, those are the people who are going to stand in line. We know there's a lot of things that are coming into play, specifically in the South, where you can't hand out water.
You can't even sit down. The chairs.
You can't food,
sit down.
And those are the lines are long. But they're going to stand in line. So we need to activate them. We don't necessarily have to organize them because they're going to stay there. Right. So I find it really interesting on that front. Right.
And then talked about another segment of that was the aspirational activists, which is really interesting to me, especially being on social media and what that looks like. So they said that the aspirational activist accounts for 13%, and it says that Black votes can only matter after Black Lives Matter. And so the ages are 18 to 49. It talked about the voting power, income being around 100K to 250K, women and LGBTQ, strong Black solidarity, mostly Democrats, moderate vote likelihood, urgency to fight injustice. And so it says that the top issue for that group is abortion rights.
Yep. And so where we see some of the bigger clusters outside of that, so we're talking about like, who do we really truly need to organize? And this is where you're seeing a lot of people focusing on, right? It's number one, the next gen optimists, which is about 21%. One of the things that they say is if I knew there was an election, I would have voted in it. Right? Which is interesting because, and I think this is really talking to not necessarily the presidential election maybe, but some of the local elections as well. But this is really the age group of 18 to 49, those millennials and Gen X. And so they talk about they must trust the sources and the info, their strong Black solidarity, strong Democrats. But the group I really want to hone in on, which I think is really important because we hear this all the time, right? And we know people who fall into this category are the rightfully cynical.
And so rightfully cynical, which the term in itself is kind of funny, but rightfully cynical, right? So that's 29%.
Yes.
And it says that my hood ain't get no better under Obama and no worse under Trump, so why vote? And so people are asking, why does my vote even matter? It talks about the ages being between 18 and 49, and this is the youngest cohort. It talked about some Black solidarity, lowest income and education, and they tend to be independents and lean Democratic, but they disapprove of Dems and GOP, and it says the lowest vote likelihood, right? And so the top issue for them is the economy.
Yes.
We got friends that fall into honestly all of these different categories, friends or family members that fall into each of them. And I'm gonna pose the question: where do you think you fall in this in this list of people?
I will say this: when it comes to the rightfully cynical, I completely understand it. I will say this, I completely understand it, right? Because especially when you're looking at the age or the years of 2020 to 2024, we had the pandemic, we had all these different things. A lot of people say, well, I received my stimulus check under Trump, right? You know, all these different things. But then also too, you hear people where I had my student loans forgiven under Biden, right? And so I will say, you know, sometimes I sit in this rightfully cynical group, but I also too feel like in this legacy civil rights group, right? Because I always think about my grandmother and my father growing up in the South, right in Birmingham, Alabama, and hearing the stories and hearing the tests that they had to go through and the battles and not just from a history book and seeing the picture, like actually hearing those stories. I feel like I have a duty to stand. I mean, in New York State, I would say it's easier to vote in New York State than obviously down south, right? But I have a duty to stand in line. I have a duty to go and vote in those local elections. I have a duty to vote in the presidential election. So although I feel like there's days I want to be this cynic and I want to be the rightfully cynical, I do sit in this civil rights legacy group.
And I think a lot of that too, and we talk about like generations often as it relates to DEI, and as millennials, right, we were raised by baby boomers. And so a lot of those, I think, you know, values are also passed down to us as millennials. And so you kind of sit in this space where you might have some younger siblings who border Gen Z and maybe some cousins that, you know, are in that realm. And it's funny because I'll talk to my younger cousins to just get a sentiment of what they're feeling. And there's some that are just like, yeah, you know, we got to stand up to this. You know, they really activate around things like climate change, environmental sustainability and things like that, where a lot of folks are really honed in on the economy. Gas is very expensive. My groceries, the cost of bread tripled in price from 2 years ago. And now this is my center of focus because I'm struggling. Inflation has increased a lot of these prices. Corporate greed, if we want to talk about that in terms of how these prices have shifted under that as well. And so it's just interesting to see where all these different folks fit and sit, but you know, ultimately these are the conversations. And so one of the things that Kendra and I had talked about was some of the pandering that's been happening. And I think, Kendra, you could talk about some of the rappers who have come out and started to talk about this. I know Amber Rose was a topic of discussion because now she supports Trump, even though they had like video of her before supporting Democrats and you know, things like that. So there's different shifts that are happening and people are pandering to different groups. And so what do we got to say about that?
So there's a lot going on. I mean, we heard from Cardi B, we heard from so many different people in the media. And I think, you know, when we're looking at this rightfully cynical, this data is accessible to so many different people. And so I know there are a lot of people who are strategists who are looking at this to say, how do we get to this group, right? What do they care about the most? And going back really quickly before diving into that, going back to hit strategies, the founding partner, Terrence Woodbury, one thing he said in a podcast recently about Biden and Trump stepping out their outreach to specifically Black men when you were talking about the economy and rising costs. He said, Black voters in this cycle are prioritizing many of the issues that we've been seeing over the past couple of cycles, Terrence Woodbury. But the first is the economy, although I do not think there's some discrepancy here because when Black voters are saying economy, we hear them talking about cost, and that's not necessarily jobs or wages. So going back to what you were saying, right, is what they truly care about is the bread is going up, my grocery bill, like all those different things. And so we're hearing all of this, right? And I think that a lot of these politicians are now honing in on, okay, what do we also to really, you know, on a day-to-day, what do we think about? What do we hone in on? Pop culture. Right? And so... Go ahead and go there, and then we'll talk about our sentiments around... What they think we hone in on every day. Let me say that. So there's an article, though, from NBC News that says Trump courts rappers as surrogates for his campaign to win more voters of color. From Lil Wayne to Sexy Red, Trump is getting support from a brevity of rappers as he seeks to court young Black voters. So at Donald Trump's Black voter outreach event at a Detroit church last week, the church's pastor and several prominent Black Republicans joined the former president on stage. So did another unlikelier figure, rapper Casada Sorrell, better known as Sada Baby.
And honestly, I'm like, who is this?
I'm laughing like, who is Sada Baby? But
somebody know. Somebody know.
They're honing in on this. Most Republican voters may not be familiar with Sada Baby, but there's a good chance their kids are. In 2020, he went viral with the single "Whole Lotta Choppas," a pandemic mainstay on TikTok that was among the first viral records on the app. Okay, now that I'm reading it.
Which one?
A Whole Lotta Choppas. Okay, never mind.
Listen, y'all. I'm like, who?
I'm like, who are you talking about? Years later, he sat on stage inches from Trump and said he might be the first person to make me vote, fueled in part by the mere fact that Trump's team reached out to him. Him reaching out showed me like some type of effort that another candidate had showed me. Sorrell said, noting that Trump could have pursued a bigger Detroit name like rapper Eminem, a notorious critic of him. I'm trying to act like it doesn't mean too much, but it means a lot to me.
Yep. After I want to listen to what he got to say today, but off the strength of him being who he is and anybody from his campaign reaching out to me, that means something. That's a start. He might be the first person to make me vote. I don't vote. I might, but I feel like that's a start. Like, people want to say they in touch or they care about the type of people that him being elected is going to affect. Him reaching out showed me like some type of effort that another candidate hadn't shown ever. And he could have went big, you know what I'm saying? Like, I'm not saying I'm not big, but he could have went real big. Like, you running for president, he could have tried to pull up with Eminem or Donald Trump or something like that. And he got people like me here, Ice Revezo. So that mean, I'm trying to act like it don't mean too much, but it mean a lot. It do mean a lot, you feel me? Like, I ain't get up early for nobody. I got up early today.
So that's just, one of many people that Trump has been touting. But we've seen, again, so many other people, like I said, the Cardi B's, the Sexy Reds, and this is that age group that he's trying to get at.
I mean, and so it's interesting because before we started the podcast, too, we talked about how the former ex-Detroit mayor also endorsed Trump, and that's because he was released early from federal prison by then President Donald Trump, and he's formally endorsed him. So he had pardoned him before. And so you're starting to see a lot of conversations of what's happening. And I think it's interesting because even in places like Atlanta, like I have black male friends in Atlanta who I'll talk about different politics and, kind of things that are happening because they're going to Atlanta as a center of that place. Georgia being a swing state.
Right.
We know the efforts of Stacey Abrams in the past presidential election and how it swung Georgia blue. Right. And all these different races that were key races in U.S. Congress and things like that. But we talk about how there's this positioning of even black men versus black women and what voting looks like and how black women, we always saying, black women are going to save America because the votes, align with our values and all these other things and how black men don't. And then you started to look at the data and saw that was actually a lie, that black men were mostly in alignment with the values and, things that were impacting black and brown communities. And so it's just interesting to me because, you can go and get I don't even know the name of the rapper you'd have mentioned now, but a whole host of rappers, which also to a point it's like,
okay. You trying a little,
Come on, y'all. Is that what y'all really think? Like, our favorite rapper is going to vote for this person, and that's how we're going to vote? Like,
right. Right. But even,
insulting, to be honest.
And they were saying, even with Biden, he hasn't reached out to all these rappers or whatever, but he has been now on many black podcasts and media outlets, the Shade Room.
Right.
We saw Kamala Harris has now talked to Quavo.
Yes, for that's the gun
violence
reform.
Yes. So but this outreach is now happening now, to your point.
That's why I'm like, okay. And the reality is it must work, right? Like, because people are doing it. And so I don't want to just shame and say, oh my gosh, don't talk to these types of folks.
But we're more than that.
But, we're not a monolith. And I think that's what it comes back to is that we just read all these different categories of voters and, that is a larger percentage. So maybe they are putting a little bit more effort in terms of reaching that population. And we have to be real because that is touching some folks. But it's just like we need to be more educated on what people have control over. I think the local elections matter so much and we're not putting a lot of emphasis there. And so, we got, I don't know, we got work to do. But
we do.
I can tell you no rapper is going to sway me
no.
either way in terms of how to vote.
Right. But
just say that.
But the question is, where do you sit in this grouping? You talked about yeah. So I think, you know, when you're looking at the data, right, and you're thinking about, again,
tactics.
Yeah. This is another tactic, right?
It's a tactic. And, you know, folks got to do what they think they got to do and, you know, go down that road. But like I said, I think that being raised by boomers and just the alignment with values and our personal values, we're DEI practitioners.
Right.
There's a lot of anti-DEI measures that had happened under the former president,
right,
who banned DEI initiatives when he was president, right? And then that was restored under our current president. And so I will say that there's no candidate that's going to check every single box that you might be really interested in or aligned with, but you just got to weigh all the options and really choose a candidate that you think best represents you. And I think one of the things that you had talked about is just like, there is no perfect candidate, and I think you had some resources around that we should share as well.
Right. Yeah. There's no. So, you know, when we're talking about how we should be targeting certain groups, right? And again, like you said, there's no perfect candidate, but when we're sitting in this rightfully cynic group, some of the challenges that they talked about in this HIT strategies and presentation that I was able to attend, they were saying that, you know, again, these people do not believe that their lives have improved under Biden, are oblivious to progress that has been made. I wouldn't necessarily use the word oblivious here, but for me, you know, I understand where they're coming from. Where they say 80% of the Black policy agenda has been initiated or achieved since 2020, and that's where you kind of have to hone in on, right? And they provide specific messaging that can be used, but they also said there is a right and wrong way to talk about progress, right? So for this group, it's not really necessarily talking about like, are you sure like this, you know, that you haven't been following this should have been happening, whatever the case may be, like not beating them over the head with it, but also too really sitting down and talking about what progress has been made. If they have specific, you know, issues that may be coming up or whatever the case may be, kind of talking through it with them, not necessarily saying you should be voting for Biden, you should be voting for Trump. It's really talking about that progress and what that looks like. And here they talk about progress equals power. Right. And only if they knew what the progress was happening, they can kind of be more of an informed voter when it comes to those specific groups.
I know one of the things that I want us to probably lean into, and we got some time right before the election, is like, you know, voting in general. So like the perfect decision versus the best decision.
Yes.
And we know we have a two-party system. What does that look like? There's a lot of folks who don't fall in either one strongly, right? And so you kind of got to align yourself, like we said, with the most, you know, I guess decision that really connects to you and your values and what you believe in. And so, you know, I guess that's a question that we're going to leave for y'all, right? Like, y'all let us know, how do you consider all these things? You know, when you think about these different groups, where do you fall into that? What are the types of things that you need to hear and connect to in order to feel more aligned with one of these parties, right? Because we only have two choices come November. I mean, you have more than those choices, but ultimately
it's those two choices.
It's really those two choices. You know what I mean? So let us know how y'all think. What you're feeling. Are the rappers, I wanted to say carne asada, but
I forgot what
that's
it
definitely
is.
some Chipotle option, so I don't even know. I feel old too, because I'm like, who? What?
This is where the granny emoji would be insert here.
Right?
You know.
But yeah, let us know what your thoughts are on that and how y'all connect. Also, follow us, right? We keep saying follow us, but the engagement has increased. Let us know what you want to hear, because we're open to bringing guests on and having conversations. So follow us, like, subscribe, all those things. You know?
But before we go,
I always do this too, right? Like, before we go, we got to give a gem to the people.
I'm gonna let you go first.
I knew you were going to do that.
Always.
Okay, so my gem is going to go to balance, right? I think we had some fun this past weekend, able to let our hair down and be outside a little bit, but you know, try to get as much balance as possible and seize the seasons. That's my gem. I'm seizing the summer.
The seasons.
You know, I'm not going to complain. It's been hot, but it feels really good. And so I would say, you know, try to get outside, y'all. Get some fresh air and some sun. What's your gem?
I would say going according to, you know, what you had talked about is really just embracing the season, but being in the moment.
Okay.
One thing about me is I always try to be 2 steps ahead. But it's always this same, I don't know, mindset that I've been having every Monday, every Tuesday. I'm at the gym by 6 a.m. I keep talking about the gym, but I am.
Yeah,
I'm at the gym every morning. But Mondays and Tuesdays, we really talk about being planted and being rooted to where you are.
Okay.
And so that has been really sitting with me the past couple of days, really to just silence the noise and just be grateful for everything that comes my way. So that's kind of what maybe it's also because it's my birthday in a few weeks. I keep saying it. I don't know why.
Listen, y'all. The birthday is coming up. Maybe we're gonna do like a special birthday podcast.
I think the reason why I'm so excited for my birthday this year, normally I'm not like, oh, my birthday is coming up, but I think I'm really excited about it is because this is probably, in terms of the best version of me, this is like the best version of me.
I love that. Okay.
So there we go.
Okay, so I'm gonna let you rock then because, you know, it's always cancer season, blah, blah, blah.
But I'm not normally I'm normally not like, oh, it's my birthday, it's cancer season, but I'm just really enjoying
feeling good.
This version of me. And I've been working super hard to get here, so I'm just embracing it.
Okay, I love that. I can put some extra support on that.
There we go, a little
cancer.
sprinkle.
I put a little bit more extra support on that. But all right, y'all. This is the Black Gems Dive In podcast.
Yes.
This is episode 55.
Whew, I can't
so we've been doing this.
I'm so excited.
We've been doing this, but we'll see y'all next time.
Yes.
All right.
Bye.
Peace.